This is part of the routine healthcare workers go through every day, 7 days a week, getting their personal protective equipment on to test patients. For speech pathologist Stacey Matisse, it's her new reality.
By having us do this, speech language pathologists, occupational therapists, it frees up the nurses to be doing the frontline work in the hospitals and continuing on with other public health programs.
Because of her training, Matisse is qualified to work in and around people's mouths. Despite that, it was a big adjustment.
It was definitely a learning curve when we first started. There were some anxieties related to the environment and the situation, but once we had the instruction and the training around the PPE and the process, it's a very easy situation to come into.
This eco station is where patients have been coming to get tested for COVID-19, and you can't just show up here unannounced. You have to call 811 at the health link and talk to a registered nurse to see if you meet certain criteria. If you do, an appointment is made for you so you can show up. Once people drive in, they are asked to turn off their cars, ID is verified, a swab is eventually taken, sealed up, and ready to be tested in the lab. The whole process is usually done within 10 minutes.
We do point of care risk assessment, so the girls that are swabbing, they have to wear their full PPE. And us, if we can't maintain that 2-meter distance, we're all masking. So it's the reality that we're living in.
One of the biggest challenges for healthcare workers is changing their protective clothing each time a new patient drives up.
It is nice to take the mask and the shield off at the end of the day or at our breaks, but for the most part it's become fairly routine, and it's not too much to be putting it on and taking it off. It just is what it is.
AHS says the clinic can handle up to 98 patients or 14 cars per hour. Sharon Fix makes sure the clinic runs smoothly. With over 25 years of experience, she says the pandemic has tested the system and her colleagues.
It's different than what we've ever done before, but something that we have to look at as a challenge and just embrace it and do what we need to do. Our job is public health, so we want to keep our public healthy and safe.
The facility runs 7 days a week with various workers rotating shifts. Patients are notified about their results within 2 days. Mindori Wall, CBC News, Edmonton.